Welcome to COVID-19 Beyond the Biology from Temple University's College of Public Health. Thank you again for sticking with us through our technical difficulties. My name is Dina Stonberg. I am a graduate of our school in 1998. I'm also adjunct professor in the Department of Social and Behavioral Sciences. Here today, very exciting, we have Dr. Mark Salzer. He is a professor of the Department of Social and Behavioral Sciences at Temple University and the principal investigator and director of the Temple University Collaborative on Community Inclusion of Individuals with Psychiatric Disabilities. We have Dr. Gretchen Snethen. She is the assistant director for the Temple University Collaborative and associate professor in the Department of Health and Rehabilitation Sciences at Temple University. Her research focuses on using community-based recreation and transportation to increase community participation. We also have Dr. Bryan McCormick. He is a professor in the Health and Rehabilitation Sciences Department at Temple University. His research focuses on the role of everyday social and community functioning in health and well-being for adults with serious mental illnesses. His work with the collaborative focuses on the interrelationships of body functions, activities, and community partnership. Today, we're going to talk about vulnerability factors, prevention, and early intervention, how we keep connected while staying apart, strategies for remote community participation, resources and risk reduction, and then ways to mitigate the negative impact of COVID, physical distancing, and the economic changes on mental health as we move forward. I'm going to ask if you have any questions to type them into the Q&A box down at the bottom part of your screen, and we will get to those at the end of the presentation. Dr. Salzer, you're up.
Thank you, Dina. Well, it's great to be with everybody today, and it's a wonderful opportunity for us to talk about the mental health impacts of COVID-19, both now and in the future, and what people have been experiencing. And I guess we wanted to start with just a little bit of a lay of the land about what's been going on from a mental health perspective. We actually, just yesterday, there was a national survey that was conducted that's gotten a lot of press, suggesting that approximately 34% of the US population has been experiencing depression and or anxiety associated with COVID-19. This probably isn't very surprising to all of us. This has been a pretty distressing situation we've had to experience. I don't always remember dates and times, but I know that I started sheltering in place on March 13th. That was the last day that I came into work, and again, to a certain extent, that certainly was a very stressful time, especially early on as I tried to adjust to what was happening in my life, what was happening to my work life, what was happening to my family's life, fear about getting COVID and testing positive, fears about what were happening in the world have certainly created a lot of depression and anxiety for people, including people who where that wasn't a common experience for them. There's been a lot of concern nationally, in addition or along with that depression and anxiety, about impacts on suicide and substance use. I do know that a previous session that our College of Public Health did cover the substance use consequences or associations with COVID, so please check that out when you get a chance. We definitely wanted to make sure that you're aware of here's my high-tech slide, the National Suicide Hotline, and of course you can't see it there, but it's 1-800-273-8255. You can easily Google it to find it. What I've been hearing is, anecdotally, is that these hotlines are not getting a lot of calls right now. States are also developing warm lines as well. These are places where you can go and you don't have to be suicidal or be thinking about that, but you can just call to speak to a friendly voice. So please look for these things. They're probably not, people don't know they exist, and I suspect we haven't done a good job as a mental health, public health community to really get the word out about the availability of these things. So really just wanted to share that, that mental health issues are definitely rising right now, and people are being impacted by them, and very distressful. Thank you, Gretchen, for putting that in there in the chat box, so take a look at that. I also wanted to say, however, that the good news, I guess, related to situations like COVID-19, I've done some research in the disaster area in the past. There's been a lot of concern about what the long-term effects of man-made and natural disasters. This would be considered a natural disaster. They usually are associated with increases in mental health issues, depression, anxiety, and other kinds of conditions. But they usually don't result in new long-term cases. And what seems to happen is as people return to normalcy, there does seem to be a return to baseline mental health and wellness that people had, in this case, pre-COVID. So the good news is long-term, we should be okay, but in the short term, we absolutely have to be understanding, be aware of these types of issues, and provide as much support and resources to people at this point in time. The last thing I wanted to mention about mental health consequences related to COVID-19 is, unfortunately, we're also being impacted by more than just the virus itself. And the psychological or mental health impacts of the virus, and the fears and the depression associated with the virus, as well as the lack of social connection and the disruption in our work lives. The economic impact may be the biggest mental health impact on people's lives right now. It's something I've been particularly concerned about. The unemployment rate that is well into the double digits at this point. Some people are estimating that it'll be well over 20% unemployment, maybe approaching 1/3 of the population being unemployed. Unemployment has a huge negative impact on mental health. And this is the thing that might last even longer for some people than the immediate impact of the shelter in place and isolation, physical distancing associated with COVID. So those are some of the things that I wanted to just say in regards to mental health and COVID. So thank you. Dina?
Wonderful. Thank you so much, Mark. We appreciate that introduction. Dr. Snethen, you're next.
Gretchen, you're on mute.
Thank you. I wanted to talk about some of the things that we've been doing at the collaborative, really responding to the stay-at-home orders and the physical distancing. So if you're not familiar with the work of the collaborative, our work is really focused on promoting community participation and really the medical necessity that is. Being engaged in your community is, Josh says I'm off center. Being engaged in your community has benefits to your physical health, your mental health, your social connectedness. A lot of us, we're Temple community, so we spend a lot of time on campus, which means we walk around the environment, we visit offices, we have friends in the office. So it's really, I think, obvious, probably more so now than ever, to think about the health implications of community participation, particularly when it's removed from everyone. And so as our work was, everything was ground to a halt, but really our work and our efforts around promoting community participation had to shift. We had to think about how we do this differently, because while engagement in the community is in a typical sense on hold, it doesn't lose its importance. And so we really wanted to look at ways that we were able to support people with lived experience of mental health, but also those people who are experiencing issues related to mental health that might put them at risk for continued mental health issues. So we created a number of resources that are specific to staying connected while physically distancing. And you may note that Mark and I both use the term physically distancing instead of social distancing, and we do that intentionally. Physical distancing is what we're doing because we're staying physically apart from each other, but it doesn't mean that we shouldn't stay socially connected, and the mental health benefits of staying socially connected are very important. So we've actually hosted a number of webinars around we did a national one, but then we've done some individual state ones, and I will share the resource here in the chat box that features a number of different strategies that you can do while staying physically distant from people. And it talks about a number of different ways or areas of participation. So there's looking at religious participation, there's social connectedness, there's physical activity and exercise and leisure and recreation, there's arts and culture. And one of the things that we know is particularly challenging for people with mental health conditions is the access to technology. A lot of people have phones, but their phone might be their only way to access technology, and they may not be sure what their data plans allow for. And so we made a good effort to provide some resources that were high tech. So, going through the museum tours that are on virtual tours, but also thinking about some mid-tech, so using your phone, and then low-tech options as well. And one of the things that we were able to find, just as an example, as a mid-tech, is that podcasts, basically any podcast that is online can be turned into a phone number. So you can call that and then listen to it. And it's a way to connect, help others connect with those resources. And then we've been talking with some peer support specialists or certified peer support specialists in Delaware that are doing some really cool things and supporting individuals who live in, who were formerly or currently homeless. But Delaware has a big initiative of getting everyone into hotels right now. I was trying to think of the right word. Hotels, and their ways of staying connected with them. Some folks don't have phones that they've previously supported, so they're writing letters. There was one example of a woman who her daily support with a participant was to bring coffee, and she's still finding a way to do that, even if she's dropping it off at a group home with the staff, and the person inside knows that that's coming from her. So there were just some really creative ways that people are thinking about how to support and connect with each other. And if our document wasn't enough, because that does require some initiative, either on a provider's side or on the person's side, and if you're dealing with mental health issues, it might be difficult to do that. We wanted to take it a little bit further and provide some more active services for people who would be interested. And so we've also created 3 different opportunities for engagement in what we think are meaningful activities. And one of them is Story Slam. We hosted our first Story Slam 2 weeks ago, I believe. Again, time is a little bit nebulous right now, but I think it was 2 weeks ago. And all of our themes are focused on community participation or social connections, and they have some connection to right now. So our first one was long distance connections, and some people were telling stories that were relevant to now, but other people were telling stories that were relevant across their life. Because while this is a very unique opportunity, we've all dealt with similar things in maybe smaller examples. So, moving across the country is something that puts people physically distant from their loved ones. And so they have to think about how they stayed connected to them. So it was really a nice way to talk about community-based activities. We had a great mix of individuals. We had people with lived experience. We had people, we had providers on the call. We had loved ones. And so there was really just this great dynamic of individuals telling stories. We have another Story Slam coming up June 11th, I believe, but I might be totally wrong on the date. But I'll share that in the chat box when I'm not talking. And then finally, we have two things that we're calling Connections RX, which I think are pretty cool and innovative. And one is a private Facebook group that anyone can join. And it's all about sharing activities that people are interested in doing, providing that social support for people who are engaging in different things. And we have some themes related to participation, just to keep the flow of things and the diversity of activities going. And so that is, I think, been super helpful. It's also, we've provided as a resource for providers, so they can model it if they would like to, if they're using Facebook. And we've had some interest from individuals who, peer support groups that might be able to parallel this activity on their own. And so that's pretty exciting and an easy way to provide some support and connections for individuals. And then finally, our last initiative is also Connections RX, but it is a one-to-one support where Kira Baker, who is she is a recreational therapy intern, but she is also our community inclusion specialist at the collaborative. She's working with individuals to help them develop an individualized plan for participation during the coronavirus and stay-at-home orders and even beyond, but really thinking about what are your goals for participation? How can you stay connected? If there's certain types of technology that you have access to, but you're not really familiar with it, it's an opportunity to really explore and learn those things and gain some confidence in using it in a safe environment, and then, and really getting that encouragement to go out and use it with your friends or whomever that might be. And part of that, what we found in terms of the disruption that this has caused is that we all have a schedule. We use the bus, we have work, we have, if you're a mental health consumer, you go to the clinic at certain times. And right now there's really no schedule. And by supporting people to engage in those meaningful activities, to identify them, to set some priorities, we're helping people to regain that structure and that control, and hopefully identify and participate in those meaningful things. I will share some links. It looks like Kira might be doing that now too, because she's on. Hello. So I'll be quiet now and share some things.
Thank you so much. And Kira says that the next Story Slam will be on June 18th. So thank you, Kira. And Dr. McCormick.
Sure. And Gretchen, you're always a little off center, which makes working with you so wonderful. Gretchen had mentioned a couple of different things. I think some of the things as I think about what's happening, and one of the last things Gretchen said really speaks to an issue that I've dealt with and really focused on, trying to figure out ways to focus on more on it. And that's the role of obligation. And when we lose obligation, most of us, and this also links to Mark's concerns about the loss of employment. Employment isn't just income, it's a structure. And we're actually fortunate in that many of us are still able to maintain our jobs at a distance and interact with people. But a lot of times the loss of that external structure is really difficult to deal with. And for many people, it undermines their motivation. And so it becomes really challenging when there isn't an external structure that we are accustomed to, like a job. And so this really can make it so that people really fall into sort of an inertia and have a very hard time getting out of bed, doing anything, because for some people it feels like it doesn't matter what they do because every day is the same. And so this is, I think, one of the real challenges of the loss of sort of these contacts. One of the other things that's been something that we've been looking at just recently and are currently working on some research on it has to do with the challenges of maintaining cognitive function when we're losing contact with other people and environments. And really, one of the big challenges and one of the things that I've been interested in is how our participation in the community and how our interaction with others maintains our ability to function and cognitive function. And it's really about, it's exercise more or less. And in many ways, what we're dealing with really is a loss of cognitive exercise, particularly when our environments have been shrunk down to, our home and very little interaction. One of the things we do say at the collaborative is that community participation is a medical necessity, and there are a lot of things about it that really play an important role in people's health and function well-being, not just for adults with mental health conditions, but for everyone. And one of the things that really is oftentimes lost and has been lost in this pandemic has been the little acts of kindness that we do to other people, the way we hold the door for somebody when they come in, the way we say hello or thank you to somebody when we get off the train. You know, these are tiny little acts, but we've lost this kind of connection because we're all now living at home. And for many people, they don't have the sort of fortunately, Dina, we all don't have 11 Zoom meetings a day. That's outrageous. But we don't have, you know, those regular sort of interactions. And particularly when we've lost that, this becomes really challenging. We are actually currently conducting a study on social networks of adults with mental illnesses in this situation and seeing what's happening if there's a loss. One of the challenges that we've seen is that adults with serious mental illness typically have a fairly limited community participation. And there are a couple of ways of looking at the way this pandemic has affected adults with these serious mental health conditions. One may be it may not change their lives a great deal because they were already fairly socially isolated. But at the same time, it may also make it for people who have very limited social contacts, they may lose the few contacts that they have. And so this becomes something that we're really somewhat concerned about is the potential for people who have a tenuous social connection to begin with to actually lose some of those contacts as a result of this pandemic. I mean, there are many community mental health providers who are doing some of the kinds of things that Gretchen talks about, you know, social distancing, but still trying to meet people and help them and stay connected with them. So we've seen a lot of that. I don't know if this is a point to talk a little bit more about the webinars that we've done. Okay. Gretchen mentioned some of the webinars. So beginning at the end of March, we created a national dialogue on how to stay connected. And this is the resource that Gretchen had talked about, how to stay connected while staying apart. And it was interesting because there certainly was a need. There was a real concern about how people could be remaining connected when we are being asked to, the term used, social distancing and really physical distancing from others. Just to speak to that need, in approximately 7 days, we had more than 200 registrants for this national dialogue. And so it was a combination of our presenting potential resources as well as truly a dialogue. We learned a lot of different resources from others, and we're able to share those. And this document is one that sort of was built over these different dialogues. We talked about ways to participate in different aspects of the community. And Mark just, shared a link to the document itself. And so it breaks it down like that. And as Gretchen mentioned, we were conscious because particularly in a national dialogue and then in the 2 states that we were working with most directly, there were both urban and rural needs. And so trying to think through how do you help people to remain connected, not only when they have access to all these resources, but perhaps when they don't have access to resources and when they actually are in fairly resource poor locations, be that in an urban setting or a rural setting. And so we really consciously developed high-tech, low-tech, and no-tech suggestions about how to help people to remain connected. And Gretchen talked about sort of letter writing. You know, we've talked about different strategies. One of the ones I refer to as our family once did a progressive story in which each member of the family wrote a chapter and then mailed the progressive story to the next person in the family, and they had to add on to it. And so it's a real creative way of remaining connected and feeling together. We subsequently followed that up with a dialogue in North Carolina in which we had over 500 participants, and then in the state of Washington when there were over 800 participants. And so it really spoke to the challenges that are being faced by the mental health community in maintaining connections. And actually, by the time we were working in the state of Washington, this was pretty much everybody working with anybody with a disability and trying to figure out ways to remain connected. I think one of the things that came out of these dialogues really is a fantastic repository of resources that we did share through APHA and a number of different ways through our networks. But again, something that I think people had to become really creative, and we really saw that in these dialogues. We saw incredible creativity. Mark, you want to talk about your Connect 6? I think that was one of the most interesting ones.
Which one?
Is it the Connect 6? What was the?
Strive for 5. Well, let me just follow up.
This is even better.
Strive for 5, yeah, a little less than 6. As Bryan mentioned, and Gretchen as well, I mean, we take a somewhat non-traditional approach to addressing mental illnesses and promoting mental health, especially among people with very significant mental health issues, schizophrenia, spectrum disorders, bipolar disorder, major depression. Even though these issues that we're talking about today related to COVID affect everyone, these individuals with serious mental illnesses are particularly vulnerable to the impact of COVID-19 as well. And our somewhat non-traditional orientation is the recognition through research that, as Bryan mentioned, community inclusion and participation, work, going to school, dating, parenting, leisure recreation, engagement in faith communities, voting, volunteering, all of these things are good for everyone's mental health. We've got ample research that that's the case. Sometimes people talk about it in terms of social determinants of health, but these are clearly areas where people with serious mental illnesses are not participating like everyone else, with very significant health consequences, has an impact on physical health, cognitive health, and mental health and wellness. So part of what we've been doing to respond to this current situation with COVID-19 is to figure out and work with communities around the country to figure out what can we do? How can we continue to support all of us while we're social distancing or physically distancing? And how do we support people with significant mental health issues as well? So yes, you can go get treatment, you can take medications, you can talk to a therapist, but we can also support one another, our mental health, cognitive health, and physical health, by promoting connection, by talking to people, by having Zoom dinners and Zoom lunches and Zoom dates and phone calls and writing letters. And Bryan wishes he had a puzzle every day to work on with his family. That's a little inside joke. Bryan likes puzzles.
Only actually done one.
Yeah, I don't like puzzles, but these are all things that are important for mental health and things for us not to forget about. Staying in touch, and again, the document that we've been putting into chat that's available really is intended to inspire people to think creatively. This is a disruptive time in all of our lives, and really an opportunity to think differently about the importance of different things that promote mental health and wellness. So Strive for 5, while of course I have a phone ringing in the background, Strive for 5 is a campaign that was initiated in New York State by the New York Association of Psychiatric Rehabilitation Specialists. And the idea is to support connections between 5 people. They don't have to be providers or people with mental health issues, just connect 5 people to one another and encourage and support them to stay in contact with one another over time, to call each other up maybe daily and say, hey, how are you doing? What's going on? How are you feeling? And also to, we've really been encouraging folks to use this approach to also talk to people about, what are you doing with your day? What goals might you have for today, or something you want to do by tomorrow? Listen to a podcast. Maybe we'll all watch a movie on Netflix or Amazon or whatever, and we'll come talk about it tomorrow as a group or over the weekend. The idea is to also help people structure their days around meaningful activities, things that make people happy, provide meaning and identity in their lives. So again, these are issues that aren't just relevant for people with significant mental health issues. They're relevant to all of us right now. And one of our hopes is that after the whole COVID situation gets addressed, hopefully at some point, that we won't lose focus in acknowledging the importance of community inclusion and participation for everyone, as well as people with significant mental health issues.
I did just see Natasha shared with us a question submitted to the Q&A or on our site that asks about resources for family caregivers and recommendations for self-care and resources for individuals caring for a family member with a mental illness. You know, this is a great question, and it is, I would suspect, even more pronounced right now, since family caregivers don't really get a break right now because people aren't going anywhere, and even some of those typical activities that you might have engaged in as respite are not available. But I think the recommendations are really prioritize time for yourself. And think, you know, we're talking about supporting people with mental illnesses to participate in meaningful activities, but I think the recommendation is the same thing for those caregivers, and really for all of us. Take the time to identify what's important to you. If it's going for a walk, make sure you have time to do that. If it is reading a book in a quiet place, try to find the time to do that. I don't know of specific resources for family members of with mental health conditions. Mark, do you know of any? I have one that I will share that is, it seems targeted more towards older adults, but I think the information is still good.
So I do know that NAMI has, they have some longstanding resources, and like a number of organizations, they are now making connections online. So there certainly is that support that people can get right now. But I think Gretchen's recommendations and what she was talking about, especially from a self-care perspective, are particularly important right now for people to be thinking about. But certainly NAMI is a good resource for people to look into. Certainly, like all the time, supporting loved ones with significant mental health issues in maintaining some types of connections, engagement in meaningful activities is also critically important right now. That will also, you know, find some time for you to take care of yourself as well. And I couldn't help but smile when Gretchen was talking, especially about families spending a lot of time right now together. Is Gretchen is working and also with her husband taking care of a 1-year-old. And watching her, I get to enjoy it because I get to talk to Sawyer pretty often in our meetings. But you know, this is a tough time for all of us in terms of being with family members, especially those with children who are homeschooling while working, while doing everything else. So it's tough for everyone.
I think also by the way, you have to say homeschooling in quotes, in air quotes. I think for parents who are needing respite, who are caretakers for children with mental health issues, respite providers are looking to find ways to do playdates, like web playdates with respite providers. And so if you're a parent who is caring for a child with mental illness or any other, if you have respite for any reason, you can certainly contact your respite provider because they are working on providing that. There's also remote babysitting now where they get a couple kids together on a Zoom. This is my world as well. I also have a child who still needs babysitting. I guess my other question too is we know that there's research related to increased screen time and more depression, like an increase in screen time and an increase in depression. Any thoughts or ideas about that, or all bets are off in this new environment? What's your thinking?
I will respond. I think it's important to think about what is necessary screen time and what is optional screen time, and trying to find some balance. 11 Zooms in one day is some required screen time, but hopefully it's not something that is every day. And you know, I found myself at the end of the day, as this was starting, just very exhausting. And I think, you know, with kids and people working and everything, we're all on the computer a lot more, well, maybe a lot more, but we're recognizing it as a lot more, even socializing, we're socializing on the computer. And I think that it is one of the things that when I worked in direct services and then some of the trainings that I've done is I've had people create like a recreation toolbox. And really matching those activities with the needs that they have at the time. So if I were to go on a walk, it might be physical activity, but it might be just an opportunity to clear my head. It might be an opportunity to engage in nature. It might be relaxing for myself in terms of benefits. You know, if I can identify those benefits, and then if I'm in a moment where I'm like, man, I feel angry, I feel stressed, I feel these things, I can go to that toolbox and I can think about those different activities. And I think it's important to have a diversity of things in there, whether it's watching a movie, spending time in nature, doing yoga, riding your bike, reading a book, whatever it is, but having that diversity of activities so that when you're, and creating it when you're not stressed, because then it's there, it's a resource for you. And then when you are experiencing something and you feel like you need to do something to change your current state, you can look at that and say, oh, this is something that I enjoy to do. Hey, I've spent 12 hours on the computer. Maybe I need to just take a step away from that. But I think, you know, I guess in terms of concrete things, being conscious of how much time you're actually spending in front of a screen, and not just letting it constantly happen to you. There are some things you can't control. There's work-related things that have to happen, or there's school or education-related things. But all of your entertainment doesn't also have to be screen time.
I think also I would add the one other thing on screen time is to think about the nature of it. Is it passive? Is it active? You know, I mean, there are lots of ways that you can use screen time to engage with other people in real time. You know, and so there are like the online games types of opportunities. And you know, my wife's family Zoom last week, we all played a game on our phones simultaneously while being on a Zoom. And it actually was kind of enjoyable. So there are ways of being creative and using screen time in different ways than just a passive observer. I think that's really one of the challenges too. But I'm also an advocate of getting outside. So.
We've been playing Cards Against Humanity with friends remotely. Yeah. So I win most of the time because I'm a horrible person. It's true. So we have a question here. What kind of policies should be established to mitigate long-term negative impacts of this pandemic?
Yeah, I mean, you know, one of my first thoughts is really trying to support people in all of us in returning to normalcy as quickly as possible. Things won't return to normal. Things will be changed, and the goal isn't maybe even to change or return to normal anyway, but try to help support all of us in returning to somewhat normal routines, work routines, educational routines, social routines. The more we can do that, and again, be flexible with that. It doesn't have to be the same way it was done before. So really taking this opportunity to rethink how those connections happen or how we engage in our communities is critically important. I have to say that one of the things I've been most gratified, there are two things I'm gratified by. One is the mental health peer community. People with mental health issues have really been leading the way in terms of coming up with creative solutions for supporting people's wellness and mental health during the pandemic. They've really been creating really wonderful options and opportunities. I heard somebody here in Pennsylvania talk about doing a potluck in her local apartment building. And but it wasn't a potluck where everybody got crammed together in an apartment. She contacted everybody. Everybody made their own dish, dropped it off at her door. She brought it into her apartment and then invited people in one by one, where they maintained physical distance, but she could check in with people, but they were able to share a meal, not necessarily together at the same time, but share some of their favorite dishes. People are walking together with a cell phone saying, here I am in this park, and somebody else is in another park, or somebody else is sitting at home. I actually did that with somebody, and it was amazing. He was in a park somewhere in Oregon that I probably will never get to, but I took a walk with him, and it was pretty incredible. The second thing again, the idea here is, what do we need to do to mitigate is to you know, try to return to normalcy, but take this opportunity to think creatively about what that looks like, is faith communities. I had spent a lot of time talking to faith communities about making services available online through the internet. And quite frankly, I experienced some resistance. Not all congregations were resistant to it, but they wanted people to be physically present. The reason we were promoting putting things online is there are people with very significant mental health issues or behavioral differences, or so depressed that they can't get out of bed, who want to stay engaged in faith community but can't make it to a church service on a Sunday morning, or a Shabbat service on Friday evening, or other types of services. And making these available online, we've really clearly seen that this can happen. And I suspect that it probably engages more people right now. So really taking the opportunity to think creatively about how we live our lives is one way to mitigate it. For people with significant behavioral differences, be it mental health, autistic people, other individuals, for us to support those individuals in being prepared for a new normal. What is going to happen in the future is another way to mitigate potential stress that might be associated with the changes that we have seen and the changes that we'll continue to see in the future as well.
Mark,
Thank you so much.
I was just going to, one of the other things that came out from some of our conversations, particularly from peers, was a hope that there might be a little bit more empathy about the impact of social exclusion. That, you know, that this isolation really is something that many people with serious mental health conditions experience regularly, and the hope was maybe other people now recognize how damaging and how difficult it is in terms of policymakers really getting a better understanding of what it's like to be socially excluded.
I also think it's an opportunity to, you know, when all of this happened, one of somewhat snarky thoughts that I had was that if mental health centers had really truly been supporting community participation prior to this, people might have some of the resources and social connections to do better. But when your only opportunity for interaction is managed by a mental health agency, it makes it really difficult. So, you know, I'm hoping that mental health centers might see that there may be times when people can't physically be there. And that is an opportunity for them to think about how individuals can navigate their own personal medicine, how they can find those things that help them feel better in their own community, and maybe rely less on that physical center, which really should have been happening beforehand, but isn't always.
Awesome, thank you. We have another question here. How do faculty and instructors support students' mental health besides just sharing resources while maintaining student and professor boundaries?
If you don't mind, one of the things, so this is something that I saw just recently because I do a study abroad, and we got together about a week or two ago with the study abroad group because it was a year since we arrived overseas. And it was really clear, one of them was really struggling. One of my students was really down. She was a younger student, has 2 years left to go. And so it's an opportunity of first of all, recognizing when somebody is having some sort of a challenge, when there's a change in their behavior, or somebody who's an upbeat personality is down, and reaching out to them and just asking them. It's still a reference to resources and suggestions, but I think just noticing that somebody's having a challenge is the first thing that you really have to do. And I think it means a lot when somebody recognizes that you're not doing so well.
I guess what I'd also like to say, and that's great, it really faculty should be aware of these kinds of things and be a safe place for students to go to talk about mental health issues. I think one thing that our center really emphasizes as well is not all responses to mental health issues have to be necessarily referrals to the counseling center or referrals for medication or those kinds of things. Certainly appropriate for some people, and we should always make these resources available to all of our students, but really providing a safe environment for students to be able to talk about mental health issues. We could convene online Zoom conversations about wellness. And Dina, I know that that's one thing that you used to do when you worked at Temple as well. And we do have a wellness resource center and would love to see online wellness activities going on. I'd love for faculty to be available to students to say, hey, I'm available if you want to talk to me about mental health issues. A lot of what needs to happen, especially now, is to validate what we're all experiencing again, the disruption that we're all experiencing, and maybe even share that with the students as well in a very safe and supportive environment. The other thing that our center does a lot of work, we do a lot of work in this mental health space with college students, is trying to provide opportunities for students to maintain some level of engagement with, in our case, Temple University or whatever college. So how do you stay engaged while we're physically distancing, while you had to finish spring semester at home or somewhere else? How do we create that sense of community while we're distancing? And again, this is something we'll be dealing with, and I think we'd love to support the university and any university in thinking about how to create and maintain community while all this is happening. That'll be helpful for students to stay engaged. It'll enhance academic performance, and it'll certainly help with mental health and wellness as well.
Thanks so much, Mark. I actually put into the comments the Student Safety Nest, which was actually an initiative that was developed when I was an administrator over health education. So that can give you some help and ideas on campus. If you are, and I see we have a lot of participants, I don't know where you're all from, but if you wanted to replicate that, I'm sure our Wellness Resource Center would love to help you do that. It's a great, it's a great program, it's a great option. And Temple does a great job at really caring for our students. At Temple, we also have Title counseling services. I am confident, though I don't know for sure, that they are doing telehealth and it's available. We also have the College of Public Health Social Service Annex, which has been made available online in Canvas, which is our online resource. I know that we always talk about at Temple that our students are a little different than other students. And so I think it's important to be cognizant of that as we are entering a summer like no other summer we've ever had. But also we have to understand that our students may have left campus or are living in different places where they have become caretakers, or they are living in places that are not safe. Or they're not living in places. We could potentially have students that are homeless or couch surfing. And so it's important that we as an institution and that we as faculty and staff understand that and really show a level of compassion that we may or may not have shown in the past. I love the idea too, and I don't remember if it was Mark that said it, about just talking about that this is really hard for everybody. And talking about that experience, because that's important as well. What about anything, and is this a little hokey, talking about a gratitude practice? I mean, are we promoting a gratitude practice? Oh, Mark, I see your face. Go ahead.
What are you thinking about with gratitude practice?
Well, you know, about talking about, this is something I started with my family, which is starting the day with, here are three things I'm grateful for, from micro, and sometimes honestly it is super micro, to a macro. Sometimes it's just like, I really like my coffee in the morning, and just being able to kind of focus on externally and focus on that. Anyway, is there any discussion about that? I don't know how to get out of this now. Here we go. Go ahead, Mark.
No, that's great. Well, first of all, you get to see who I get to see often, and well, it makes my day. I'm always thankful to see Sawyer whenever I can with Gretchen. Certainly, that type of practice, my family used to incorporate it every day during mealtime. What am I thankful for today? And I was only smiling because there's really a debate in the field right now in our mental health community about trying to focus too much on the positive right now, and it just all be positive. Really allowing people to mourn the losses that are occurring right now for folks. We know that a lot of people have been impacted by not being able to go through a graduation ceremony this year, for example, and my family was impacted by this as well this year. And yeah, I mean, that really is a bummer. And to really allow that to be okay. But absolutely, I would agree with you, Dina. Every day, I think talking about what we're thankful for, what we appreciate is certainly a great wellness approach. While not saying, I'm also smiling because some people were saying, oh, we should take this opportunity now that we're all at home to learn a new skill and start becoming expert woodworkers and learn 10 new languages and all this. And some people were saying that they felt a lot of pressure around these kinds of things, that they were just exhausted, maybe by Zoom meetings and maybe by how overwhelming this current situation is. So, but gratitude is always a good thing. And I'm thankful for Sawyer every time.
Mark, thank you so much. I was definitely not talking about skill acquisition during this time. So thank you. No. Just coffee. So I'm getting the note that we have 3 minutes left. I would like to ask if there are any other questions, maybe a closing 30 seconds from our panelists.
Actually, I'll say—
Sawyer, does Sawyer want to say anything?
I'll say, well, while Gretchen's getting Sawyer ready, I'll just say there was one other question about, do you believe the local, state, and federal government needs to allocate more fiscal resources for mental health services? Of course, those of you who don't know, mental health budgets have really been slashed pretty significantly over the last 10 or 15 years. Really 20 to 25% of state budgets for mental health have been cut back. Services have been cut back. It's really been a very tough time for the mental health community. Unfortunately, with some of the trillions of dollars that have been allocated for businesses, for Wall Street, for other entities, and for healthcare, which is critically important, those dollars haven't been, to the best of my knowledge, allocated to the behavioral health system. So it's something I know that is being talked about right now in Congress, but it's really important to focus on mental health. It is an issue. It is something we should always pay attention to. We have an opioid epidemic. We also have a suicide epidemic that preceded what's happened with the pandemic. And really the unemployment's only going to make things worse. So it's something, yeah, we need more resources all the time.
Mark, if I could add too, one of the other challenges, particularly in community mental health, with mental health being so underfunded, that many of the people working in that setting, the pay is so low that there's incredible churn in the workforce. And it's really difficult to do much that's innovative and sustained when you just are turning over people month after month after month. And so that's really, to me, that's one of the real challenges of community mental health. And it's that people just can't really make a living working in that setting for most.
Absolutely. Gretchen?
I mean, I don't know that I have anything specific to add. I think that, I think this is a great opportunity, and I really appreciate the chance to talk about mental health and coronavirus and some of the things that are happening because of the social circumstances that are going on right now.
Yes.
Thank you so much, Sawyer. No? Okay. Thank you so much for this wonderful opportunity. You're all three fascinating. We will continue with our next live webinar next Wednesday, June 3rd at 1 p.m. We're going to talk about how racial and ethnic health disparities are shaping the impact of COVID-19. Please go to our website, cph.temple.edu/COVID-beyond. I think that you will also, another series of great panelists. One of might have even been my student from my first class I ever taught at Temple. So really great group of people. Thank you so much and have a great afternoon.